As an advanced medical practitioner and pharmacist practicing in family medicine, in this video I'm going to share with you my 7 steps on how to use your blood pressure monitor correctly to get accurate readings. And as the inventor of the digital home blood pressure monitor in 1977 here at A&D Medical, we definitely know how to get the most accurate readings from your blood pressure monitor. So let's begin. Let's begin with step number 1. I want you to remember the 30-minute rule, okay? So for 30 minutes before you take your blood pressure, avoid eating, caffeine, smoking, and exercise, okay? All of these can actually affect your blood pressure readings. Also, please don't worry about what your blood pressure numbers mean, because at the end of this video, I'm going to go through all of that as well in a bit of detail for you. Straight on to step number 2, relaxation is key, and there's 4 things that you need to do. The first thing you're going to do, obviously, is you're going to sit down on a nice, comfortable chair with a table in front of you. Your arms are going to be nice and rested on the table, okay? So your elbows are nicely on the table, nicely supported. That's the first thing. Second thing, you want your feet flat on the floor, okay? Don't have your feet crossed, anything like that, flat on the floor, nice and relaxed, okay? Third thing you're going to do is you're going to have your back nice and supported, okay? So make sure the chair that you're sat on has back support. And the fourth thing you need to do is you need to go for a bathroom break before taking your blood pressure, okay? Because believe me, if any of these 4 things are missing, it can give you a temporarily rise blood pressure, so it's going to give us inaccurate readings again. Now, for more consistent and accurate blood pressure readings, most of our A&D Medical blood pressure monitors come with advanced cuff fit detection and movement detection to make sure you get reliable and accurate results. So now that I've told you these 2 first steps, I want to tell you a bit of a patient story, okay? Because sometimes we do things that we're not realizing when we're taking our blood pressure, okay? So I had a patient, this was years ago, they were using an A&D Medical blood pressure monitor. I remember that vividly, so I wasn't worried about accuracy and their machine being clinically validated. So that was a check, okay? But I asked them to take their blood pressure in front of me. Sometimes I like to watch patients and see how they're doing it, okay? Obviously, I know it's probably going to go up a bit when someone else is watching you do their blood pressure, okay? But when I was watching them do their blood pressure, they did everything right. They avoided talking, they avoided eating, no caffeine, sat straight, all that sort of stuff. But when they were taking their blood pressure, I noticed that they keep shaking their leg, okay? They had this nervous thing that they do. They just keep shaking and moving their leg. A lot of us do it when we're feeling a bit nervous and anxious. And sometimes we do it without even realizing, okay? That's obviously going to increase your blood pressure a little bit and give us an incorrect reading, okay? So I really want you to think about these first 2 steps that I've said. Think to yourself if you're missing any of these or you might be doing any of them incorrectly, because again, they can give us an accurate reading. So please bear that in mind. Straight on to step number 3, let's talk about cuff positioning, okay? If you're not positioning your cuff correctly, it's basically going to struggle to find your pulse and your blood pressure, okay? Which basically means inaccurate reading. So this is really important to do right. This is the easiest way that I always tell my patients. Put your arm out straight, okay? Palm facing up. Obviously you're going to be sat down when you're doing this, so I'm just going to pull up the cuff just so it's above the elbow. 2-finger rule, okay? So I have 2 fingers above the elbow. That's the right position. And then secondly, I'm going to tighten this so it's tight enough, not so it's overly tight, but just so it's snug enough so I can just about fit 2 fingers in there. I don't want to be able to fit a whole hand in there. Just 2 fingers gives us a nice snug fit. So please make sure that you're doing this correctly and that your cuff fits correctly, okay? That's the number 1 mistake I see a lot of my patients making. Their cuff is either too small for them or too big for them. Now, some of our blood pressure monitors, like the A&D Medical's UA910BLE, comes with what we call advanced cuff fit detection, okay? So if when you're doing your blood pressure, if when you click it and you see this symbol, it basically means that your cuff isn't fit correctly. Now, most of our blood pressure monitors come with the wide range blood pressure cuff size, okay? This means that a lot of people will fit this cuff size, but if you want more information on how to pick the right cuff size, how to measure your arm, how to make sure that cuff size is right for you, we have a video on that on the channel going in a lot of detail about cuff sizes, so definitely do check that out after you watch this video. Moving on to step number 4, it's all about alignment, okay? With our A&D Medical blood pressure monitors, all of our cuffs have this little white dot, okay? You need to align this with your middle finger, okay? This basically allows the cuff to detect your vibrations. If this isn't aligned correctly, your blood pressure cuff and blood pressure monitor are not going to be able to get those vibrations and give you an accurate reading, okay? Different blood pressure monitors have different things. Ours all have this white circle, okay? So make sure that's in the middle. and then you can close your cuff like so. This also leads me on nicely to a patient story, because I think this would be useful to know as well. I had a patient who was wearing their cuff correctly, but with the tube, okay, you always need to make sure you run it down your arm like so, and then connect it to your blood pressure monitor, okay? Make sure it's not going underneath your elbow, so then when it's on a table, it's basically blocking the tube, okay? So this is what my patient was doing. They were running this underneath their elbow like so, so then when it was under a table, it was getting blocked, and obviously attaching it to the blood pressure monitor, but then it wasn't giving accurate readings. So that's just a good one for everyone to know as well. Bit of a pro tip. So now it's time for step number 5, the part you've all been waiting for, taking our blood pressure. So just to recap, remember what we said earlier, the 30-minute rule, avoid eating, caffeine, smoking, exercising for 30 minutes before we do our blood pressure. We've done that. Also remember the relaxation we spoke about. So feet flat on the floor, arms supported, so our arms are nicely supported on this table. Our back is nicely supported as well. And I've been to the bathroom, I don't need to go for a bathroom break. Also having the cuff at the level of your heart as well. So everything is correct right now, okay? So what we're gonna do next is, also one last thing that I forgot to mention as well, is the tube. This table's a little small, otherwise I would have had the tube running down my arm just into my fingers like so, but like this, it's completely fine. Just make sure it's not being blocked or pushed under your elbow. So this is completely fine. So what I'm going to do now is I'm just going to click the start button, and we're going to fast forward this section. Straight on to step number 6. Consistency is key, okay? One of the things that I really like about our A&D Medical blood pressure monitors is we have really large screens on most of our monitors, and it's really easy to read, okay? So you can see my blood pressure, 117/76, and my pulse was 79, okay? We also do have a voice-guided blood pressure monitor that also gives audible readings, so just something to bear in mind. Now, a common question I get asked by many of my patients is, how many blood pressure readings should I take? If I want to take my blood pressure right now, how many do I take? And the best way to do it, that I always recommend my patients, is if I'm going to take my blood pressure right now, I'm going to take 3 readings, okay? Each reading will be 60 seconds apart. So I'm going to take one, wait 60 seconds, take a second one, wait 60 seconds, take a third one, okay? Then I'm going to average those results, and that will be my blood pressure reading for right now. Now, whilst we're on the topic of averaging, I want to talk about a really useful feature that some of our devices have. This one right here that I'm using at the moment is the UA910BLE. This has our trademarked tri-check technology. This basically means that the device is able to take 3 consecutive readings 1 minute apart, and then provide you with the average, which complies with the American Heart Association's recommended measuring method. You can easily turn on this setting by clicking the clock button until the tri-check symbol appears. The default is off, so use the arrow button to turn it on, click the clock again to get this set. It will then ask you for the intervals between each blood pressure reading. We have 30, 60, and 120-second intervals. I would always choose the 60-second interval and then click the clock button again, and it's all set to tri-check mode for next time you take your blood pressure reading. Straight on to step number 7. So what should my blood pressure readings be? I'm asked this all the time by patients. Sometimes patients are told different numbers by clinicians, or maybe they're not remembering it correctly, so I'm going to make it very simple, okay? Your home blood pressure readings, unless you're told otherwise by your medical provider, should ideally average around 130/80 millimeters of mercury. So anything under this is excellent, all right? If it's creeping higher than this, it's going to put you at a higher risk of cardiovascular problems, heart attacks, strokes, kidney damage. And that's why we call it the silent killer blood pressure, because none of these come with symptoms. You don't feel them happening, okay? So if you see it creeping over 130/80 millimeters of mercury, and you're checking your blood pressure readings at home, and it's constantly creeping higher than that, speak to your medical provider. Now, for anyone watching this video today, I would strongly advise you to download our A&D Heart Track app. It's free to download from the Google Play Store and the Apple App Store. It's been designed by doctors to help you collect and manage your blood pressure readings, along with other health metrics like your weight, oxygen saturation, glucose, temperature, and more, giving you the ability to follow trends over time and help your medical provider best manage your care. Also, if you have our Bluetooth enabled medical devices, you can pair it with the app, so you don't need to manually add it. Any readings that you take on the blood pressure monitor will be synced straight onto the app. for example, from the blood pressure monitor or our weighing scales. So again, it makes life so much easier, and I cannot recommend downloading it enough. So next up is my pro tip when it comes to blood pressure monitor devices, and making sure that your blood pressure monitor is clinically validated for accuracy and on the validated device list, which we call VDL for short. This is by the American Medical Association, Hypertension Canada, or the British and Irish Society of Hypertension. Because believe me, a lot of the blood pressure monitors that you can buy online on Amazon and different pages are not on the validated device list. So basically, they're not accurate. Now, I've been using the A&D Medical blood pressure monitors in my very own practice for years because one, they are an absolute workhorse when it comes to blood pressure monitors, and two, they are clinically validated by all the organizations that I spoke about earlier through formal studies, so you know it's accurate. Also, as the inventors of the digital home blood pressure monitor in 1977, A&D Medical definitely know what they're doing when it comes to blood pressure monitors and their accuracy. And to learn more about A&D Medical and our wide range of medical devices, including blood pressure monitors, I will leave a link to our website in the description below. Definitely do check it out. We're committed to helping you stay healthy with reliable products that you can trust. And best of all of our blood pressure monitors come with a 5-year warranty if you're in the US, Canada, or UK. And thank you so much for watching this video. I really hope you found this information helpful. If you know anyone that uses a blood pressure monitor, that uses a blood pressure cuff, please do send this to them and share it to them. I'm sure they'll find it helpful as well. If you want more information on using your blood pressure monitor, step-by-step instructions, natural ways to lower your blood pressure, as well as doing different tests and doing different, debunking different myths with blood pressure and seeing how it actually affects your blood pressure, we have all of these kinds of videos on the channel. So definitely do check them out as well. And as we always say at the end of every video, A&D Medical, discover precision.